So 3 things that providers should be thinking about when they're working with a qualified or certified healthcare interpreter to make it a more successful appointment. Well, the first thing that's really important is to make sure that as much as possible, and I know sometimes time is of the essence, but if you can take even just 30 seconds to make sure that the interpreter can do a debrief prior to the session. So what that looks like is where the interpreter can introduce themselves to the provider and the patient and state their role for that particular appointment. Maybe it's the first time that provider is working with the interpreter, or maybe it's the first time the patient has had an interpreter provided. And making sure that the interpreter can then set the tone, set the stage as to what is their role. I'm interpreting everything in first person. They follow CIFE, C-I-F-E. Everything is confidential in the room. Everything is in first person. As the interpreter, I'm in charge of the flow. You both are in charge of the content. And that everything that is said in the room is going to be interpreted. Number 2 is it's important that the healthcare provider understands that they have to speak at a tone that's slow enough to where the interpreter can get all the information. If you start to go too fast, yes, the interpreter should raise their hand and interrupt and make sure that they can stop the healthcare provider or the patient from speaking so they can regurgitate all the information that's said. But a lot of times there's this middle ground where healthcare providers they're speaking not too fast where the interpreter is going to stop them, but they're going a little bit fast where it's tricky to get all the information and to ascertain everything. So it's important that, yes, the appointment's going to take a little bit longer. Having an interpreter, it's just the nature of it, but you want to make sure that that patient is receiving all of the accurate information. They really do have a seat at the table. That's going to require the speed to just be a little bit slower to make sure that interpreter can get all of that message out correctly. The third important piece that often gets missed is really having a general understanding and knowledge of the role of the interpreter. We just talked about the CIFE process that every interpreter should follow and every provider should be aware of. So have your staff been trained on that? Do they understand the role of the interpreter, where the interpreter should stand, how to work with an interpreter, what to do if there is questions, or what to do if there's multiple people in the room? Getting a general understanding for how to work with an interpreter and maximize that relationship is really important. These are things that most language service companies can provide as a training, something that Linguava can do either remotely or on-site as well. It's really important that your staff have the tools to understand how to best work with an interpreter.